How many days do you think people should rest after an attack of dengue? How many days should they not go to school or go to office?
Once they have recovered completely and they are feeling comfortable, they can resume school, because it's not a contagious illness which will spread from one person to other. So if they are comfortable enough, feeling enough strength and power in them, they can definitely resume school.
Yeah, basically only after dengue when you recover, the only persistent symptom is weakness. Patient will have a tremendous weakness, few patients, but it is self-limiting, you don't have to do anything, just eat well. The second question, when you can join. So you eat well, drink well, and if you feel energetic, alert, go to the office or go to the work actually.
So can we summarize with some do's and don'ts for our audience?
As a clinician, what I can say, do's basically, if fever more than 100, take simple paracetamol. Please do not take any ibuprofen or combiflam. Don't do any self-medication. Please do not take aspirin without consulting doctor. So don't do any self-diagnosis. This is my only suggestion. Let the doctor do his job. Let him diagnose and treat accordingly. That is.
What about all these? There are all these rumors going on that papaya leaves can cure dengue and some other,
If you see in the same, coming back to the Google and internet, suppose you see there are more than 6,000 articles in the Google which shows that if you take a papaya leaves, it has a potential to increase the platelet. But as such, till this moment, there is only one study. There is no recommendation from any authority. There are no guidelines from any scientific body. There is no medical recommendation to take a papaya leaves or dragon fruit or kiwi. We don't know. Otherwise, if you ask me, all hospitals would have been closed if papaya has a potential to increase the platelet count.
What about fumigation? Society should do fumigation once in how many days? Anything recommended?
As per the government regulations and rules, once you get a dengue fever in that premises, the person will come and do the fumigation around that area so that all breeding places has been taken care. In spite of that, suppose you need to go outside, prefer to use full sleeves so that the mosquito doesn't bite you. You take all precautions. That is your job, and the government, they need to do fumigation. Once you detect the case around that area, you need to do the fumigation. And in your house, what rightly said, the flower pot, vase and all that, see that the water is changed regularly.
So how do the societies contact the government or
No, we have the instructions. Once we detect the dengue fever, we inform the concerned municipal authorities, we inform concerned government authorities, so that person will come in your area and he will do the fumigation. So even if the patient does not tell the government authorities, the hospital or the doctor who is treating him or her, he will inform the government authorities. The only issue that some patients on the OPD basis, I think that time certain lab recommendations to inform the concerned government authority that this dengue has been detected and you have to take care. So government will come and do the fumigation job actually. But on your part and clinical, as a person, do everything so that the mosquito doesn't bite you. And in spite suppose bites, go to the doctor actually. That is the only thing what I can